Hi, welcome back to NurseEdScholar. So today you have one patient that's losing weight. They're weak and their blood pressure is dangerously low. And then you have another patient that's gaining weight. They're all swollen and their blood pressure is high. Now, both of these conditions involve cortisol, but they're complete opposites. And if you mix them up, you're going to miss what the patient really needs, okay? So today, I'm going to make, hopefully, Addison's and Cushing's disease, well, Cushing syndrome, Addison's disease, finally make sense. So you can recognize it on the NCLEX. You'll be able to recognize it fast in the patient setting. And so you'll know how to think like a nurse at the bedside. Okay. So welcome back to Nurse Ed Scholar, where we just don't memorize, we try to understand. And this is the third video in the endocrine critical series. And so, like I said, today we're breaking down Addison's disease and Cushing syndrome. So let's simplify it. Okay. So, like I said, everything comes down to one hormone, and that is cortisol. Now, remember, cortisol helps regulate blood pressure, blood sugar, stress response, and inflammation. So you're going to have to, think of it like this. Addison's disease has too little cortisol. Cushing's disease has too much cortisol. So I'm going to say it again. Addison's low cortisol. Cushing's high cortisol. And that one idea will help you understand and explain everything. So let's look at these differences. Now, Addison's disease is caused by adrenal insufficiency. So there is a hyposecretion of the adrenal hormone. So that means that there's just not enough cortisol being produced by the patient. And the body can't handle this stress. Okay. Now, on the other side, Cushing syndrome, it's excess cortisol production, or it could be because your patient has been getting large amounts of steroids for weeks, to months. Okay, or they may have a tumor that's hyper secreting uh, cortisol. So the body is just overstimulated with Cushing syndrome with all of this cortisol. Okay, so let's simplify it again. Addison's disease, the body is depleted of cortisol. So the body just can't keep up with the production because it doesn't work. It's not working. The body just doesn't have the cortisol that it needs. Cushing syndrome, there's just it's the body's overloaded. It just has too much cortisol. Okay. And you'll hear me keep repeating this, keep repeating it throughout. And so this is why when you look at the pictures, a person with Addison's disease, they look depleted, they look weak, they look thin. Where the other person with Cushing syndrome, they're overloaded, they're bigger, they're heavier, they're fatter. Okay, so hopefully that helps. Now we're going to talk about labs. Now the NCLEX, test your understanding of Addison's disease and Cushing syndrome. A lot of times do lab values. So with Addison's disease, the cortisol is low. The patient is depleted. The adrenal gland is not producing the hormone. Sodium will be low. So your patient's going to have hyponatremia. Potassium is going to be high. So they're going to have some hyperkalemia. And glucose is going to be low. Cortisol, we always talk about steroids and how steroids can raise up blood sugar. Well, in Addison's disease, patient doesn't have that cortisol. So they're going to have hypoglycemia. And a patient will also have dehydration. And you're like, dehydration? Why? Well, water follows sodium. So if the sodium is low, then the patient is not going to be uh, retaining water. So they're going to be losing sodium and losing water, but retaining potassium. And with that, the blood pressure drops. And the blood pressure drops, and I'll talk about this again in a few minutes. The blood pressure drops because when a person has low cortisol, there's decreased vascular tone, decreased vascular resistance. So that's also contributing to the hypotension and that drop in blood pressure. Okay, so with Cushing's syndrome, the cortisol is high. Okay, um, the sodium is high, so your patient's going to have hypernatremia. The potassium is going to be low. They're going to have hypokalemia, and their glucose is high. They're going to have hyperglycemia. And you're like, okay, what's going on? Well, the body is retaining sodium and water, and they're losing potassium. So the blood pressure is going to increase because of two reasons. One, they have high sodium, so the body is retaining water to try to dilute the sodium, so it's going to hold water. But then on top of that, increased cortisol causes um, vascular constriction. Okay. Now, I like to repeat a lot. So remember, Addison's, when you talk about labs, everything is low except the potassium. With Cushing's disease, everything is high except the potassium. Okay. This pattern may show up on your exam, so try to remember it. Addison's, everything is low except the potassium. Cushing's disease, everything is high except the potassium. Okay. Now, what does this patient look like? So, with Addison's disease, you're going to have weight loss. They're going to have muscle weakness. They're going to have fatigue. They're going to have hypotension, and that's due to the loss of the glucocorticoids. And like I said, reduced amounts of cortisol. There's a decreased vascular tone, there's decreased vascular response, in addition to that dehydration. So your patient's going to have hypotension. They're going to have hyperpigmentation of the skin. So they're going to have a bronze tone to their skin. They may have menstrual changes, uh, impotence, maybe even some gastrointestinal issues. And you're like, why? Because the body is depleted. They do not have cortisol. Now, with Cushing syndrome, remember everything is high except the potassium. So, high, they have lots of cortisol. So, they're going to have weight gain. They're going to have a round moon pie face. They're going to have a buffalo hump. They'll have a buffalo hump. They're going to have thin skin, easy bruising. They're going to have hypertension due to the retention of water. Remember, with Cushing syndrome, that sodium is high. And then also the high cortisol causes vasoconstriction. So those are causing the hypertension. A person with Cushing syndrome, they may have some masculine characteristics. They may have some muscle wasting, maybe some weakness. So the person's going to look all big and swollen, but they're going to be really weak. Okay. Now, let's talk about it again. Addison's disease, they are depleted. So they're going to be thin and they're going to be weak. They're going to be fatigued. With Cushing syndrome, they're going to be swollen with all of that cortisol. They're going to look overloaded because the cortisol, um, they're going to have a lot of sodium retention, and water follows sodium. So they're going to be all swollen. So they're going to look big, but they're going to be weak inside because, their body is off balance. Okay. Now, what's actually killing your patient? Okay. So with Addison's disease, they have low cortisol. What happens with low cortisol? There's that decreased vascular tone, and they have the dehydration, and they have that hypotension. And that hypotension can lead to shock. They're going to have hypotensive shock. Okay. With Cushing's disease, they have that high cortisol. Now, you'll learn when we're talking about cortisol levels or we're talking about steroids, that can put a person in at risk for infection. So that high cortisol can lead to infection risk and lead to hypertension complications because if you remember, cortisol causes vasoconstriction. And also with Cushing syndrome, they have high sodium, which is going to cause high water retention because the body's going to try to hold in the water to dilute the sodium. And so they're going to have that hypertension complication. So remember, Addison's, low cortisol, hypotension leading to shock. Cushing's, they're going to have long-term complications. They're going to have an infection risk. Now, as a nurse, what's the priorities? What are you looking for? What orders are you looking for? What are you going to be doing to help your patient? So you're going to, see an order to give steroids in your patient with Addison's disease. Remember, they're depleted of cortisol, so you're going to have to replace it, and that may be lifelong. That person may be on um, steroids like hydrocortisone for life. Okay, you're going to monitor their blood pressure. Remember, they're going to have hypotension. You're going to monitor electrolytes, that sodium, that potassium. You may see orders for them to increase their sodium intake. Remember, those with Addison's disease has low sodium. So you may see increase in order for, some kind of way of increasing their sodium intake. And you're going to monitor those I's and O's because remember, low sodium, low water. So the patient's going to be dehydrated. So you're going to monitor their I's and O's, their intake and output. So one thing about Addison's patients is that they need steroids. Okay. Now for Cushing's, what are you going to do with your patient? You're going to monitor their glucose. They're going to have that high cortisol. So you're going to monitor glucose, their white blood cell count, because they're going to be an infection risk, sodium, potassium. You're going to monitor their blood pressure because of hypertension. We talked about increased cortisol causing vasoconstriction, and then also that water retention. So you're going to monitor the blood pressure, prevent infection, because that high cortisol level puts the patient at infection risk and reduce corticosteroids if possible. So look for the doctor, I guess, trying to figure out a way if they can taper down the corticosteroids. Just look for orders for that. Also, monitor intake and output. And you're going to also have to monitor weight because these individuals will have that fluid retention. And so you want to make sure you monitor their I's and O's. And remember, with Cushing syndrome, these patients have too much cortisol. So, NCLEX tips and traps. Okay. So, if there's a question about who needs steroids, that's going to be Addison's. If you have a question about who needs some kind of infection precautions, that's going to be the person with Cushing syndrome. A lot of students make mistakes when it comes to these types of, the disease, Addison's disease, and the Cushing syndrome because they mix up the sodium and potassium, not remembering what's high or what's low. They forget the cortisol. High cortisol causes this, low cortisol causes that. They'll treat Addison's disease and not give any steroids. So if they have choices, they'll miss that this patient needs steroids. And they may miss the infection risk for the Cushing syndrome. So these are some kind of NCLEX traps that you may see because the NCLEX wants to know, can you recognize low versus high cortisol? So let's do a quick recap. With Addison's disease, you'll see low cortisol, low sodium, high potassium, hypotension. And this patient's going to need steroids. So Addison's disease, everything is low except for the potassium. Cushing's disease, you're going to look for high cortisol, high sodium, low potassium, hypertension, and that patient is going to be at an infection risk. So remember, everything's high except for the potassium. So Addison's, everything is low, they're weak, they're fatigued, they're tired. Cushing's disease, everything is high, and the patient is overloaded. They're overloaded with the cortisol, they're overloaded with weight gain and just overloaded. So now, hopefully, you understand Addison's disease and Cushing syndrome. Um, the next question is going to be, what happens when the thyroid hormone goes too high or too low? So in the next video, I'm going to be breaking down thyroid storm and myxedema coma. And so please go watch it, so all of it connects. And so that's it. I really hope that this finally helps you understand Addison's disease and Cushing syndrome. If so, please like the video. Please subscribe to NurseEdScholar. Save this for your exams, to help you study. Because here we're just really not trying to memorize. I'm trying to help you think like the nurse that you always want to be. And so I'll see you in the next video and happy studying from NurseEdScholar.